Welcome, Dr. Kress.
Thank you.
Oh, it's our pleasure to have you on with us. It's your first time, in fact.
It is, and I'm happy to be here.
Well, we've got a lot to talk about, so let me just start right off the bat, if I may, by asking you if you can please begin by telling us what are some of the most common facial problems that many of us experience as a result of aging.
Most people age in a fairly characteristic pattern, and it involves several things. I mean, the first thing is that the elasticity wears out of the skin, and like brain cells, once you lose your elasticity, the body has no ability to replace the elasticity. Second thing that happens is that the face, which normally is attached to the skeleton or the skull, loses some of its attachments and begins to drift down. And the third thing is just the development of some of the extra lines. The extra line coming off the corner of the nose, coming off the corner of the mouth, buildup of the jowls. Those are all part of the natural aging processes. And there's and that, of course, since we're talking about the face in general, that's also accompanied by, sometimes some sagging of the mouth and the aging effects that show up in the eyelids. And anything that you're going to do to correct those things has to address all of those issues. The results of loss of elasticity, the loss of attachment, and the accessory lines that begin to form. It depends upon what your goals are, what the options are to correct those things.
Well, that brings me to my next question. In fact, what are the latest techniques that address these problems?
When I have people that say, I just want to do something small, I'm tired of people, saying I look tired all the time, I go right to the eyelids and I start talking to them about the eyelids. The eyelids will make you look happier, refreshed, new lover, great vacation, all of those kinds of things, but not younger. And if you want to look younger on a short-term basis, there's a beautiful new array of fillers and things that have come out. So, a short-term solution to some of the aging problems might be to do some fillers to just soften some of these lines, and that's going to visually turn back the clock a few years.
Now, what about the facelift as one of the techniques as well that can certainly make us look much younger?
Well, the anchor of all of turning back the clock for real is going to be the facelift, and there's exciting things have changed in the facelift, and primarily in the last 5 years. The traditional facelift 25 years ago was the artificial facelift. That was just a skin lift. So it was a huge cut that wrapped around the ear, and the skin was pulled tighter. And if you wanted to try and make it last a little bit longer, then you pulled tighter. But what that
the Joan Rivers effect.
The Joan Rivers effect, exactly. It created something that was so unnatural that the people had to hide out, and even when they did come out, they didn't necessarily, their face didn't move in the proper direction. But over the last 5 years, there have been some really interesting pioneering work coming out of Belgium, West Coast, Pittsburgh even, and what they stumbled into is, so it's a much shorter incision that just barely wraps around the ear or around the sideburn. Primarily that came about with the S-lift and something called the Max lift, M-A-C-S lift. That's the one from Belgium. And so the smaller incision, less undermining of the skin, and instead of using the deeper tissues and making a whole nother flap out of that and pulling it back towards the ear, they use a little tiny suture that goes around in a loop, and it folds that tissue on itself so that when it heals, it sticks together, and that gives you the support you need. And what they stumbled into was they changed the vectors of the facelift, of the traditional facelift, to a very vertical vector, which is a lift against gravity. And what we've come up with is an operation that can be done instead of 3.5 hours, 1.5 hours, with a much quicker recovery time, much less risk of some of the complications. Some of the complications that could occur with the traditional lift are nerve injuries and things.
Sure.
With the mini lifts, that's much, much less likely because the loops are placed underneath the skin in areas specifically where we know the nerves don't exist. So I think there's very exciting changes in the field of the facelifting itself.
How are these procedures performed?
The traditional facelift would normally be done in a surgical facility that can accept general anesthesia, and you'd be looking at a procedure that would be a minimum of 2.5 hours, depending upon the skill of the surgeon, and maybe as long as 5 or 6 hours, and depending upon what ancillary procedures you would do, such as something to improve the quality of the skin or working on the eyelids at the same time. The newer procedures, which we're going to call mini procedures, a lot of times they're done just in the office under local anesthesia, and their time range is more in the range of an hour to an hour and a half for those procedures.
So we're not talking a lot of time at all here.
You're not talking about a lot of time. But we're also not going back to work that afternoon. We're going home and rest and put some ice compresses on.
can a patient undergo a combination of these procedures, or elect to have a combination of these procedures, I should say?
Absolutely. I think that probably 60 or more % of the people that I do some combination. And some of the possible combinations might be resurfacing of the skin, either with mild chemical peel, combining the eyes with the face, something extra maybe with the neck. Even I've done facelift with chin implants for people that had very short chins, and with a short chin, it's impossible to get a good neckline. So we've combined necks with that. Also procedures to enhance the lips, or in the case of our African American clients, sometimes we reduce the size of the lips to something that is in a better balance. And now another field that's done tremendous expansion just recently in the last 10 years has been facial implants. Facial implants go in extremely fast and can dramatically change the appearance of the face. You know, as one of the things that we talked about before, where you lose the attachment to the skeleton, and this nice round apple cheek that you had when you were younger begins to drop down and turns into the jowl of age.
Yes.
The facelift will put that partly back up, but you've also lost some of that soft tissue. So to get that fully recovered, in some people, sometimes what we want to do is slip a little implant in that sits on the area of the cheek.
So it rounds it out basically and brings it back to what it used to be.
Yes. The implants now are so good that instead of worrying about this little lump moving out of place, if you get it close, it'll set itself in the correct position. They're so well designed.
Very interesting.
And very easy to do, very quick to recover from. I mean, you're talking about changing cheek positions and refilling this area with 10 minutes on each side.
That's not long at all.
That's not long at all.
What kind of results can we expect from this?
Well, I think a reasonable facelift, a reasonable rejuvenation procedure, not talking about the eyes. You're talking about a 7 to 10 year improvement. And people say, well, how long is it going to last? Well, the real answer is forever. And the best model of that I can state for you would be that if you had an identical twin sister and you went in for your facelift, and the facelift erased 10 years from your face, will you ever catch up to your sister who didn't have the facelift? The answer is no, you never will.
Yes.
You're always going to look 10 years younger, but both of you will continue to age from that point.